to the Policy Visibility Drive, a Ghana Health Service policy initiative created to shed light on existing policies within the health sector. In this video, we'll be discussing Ghana's roadmap for attaining universal health coverage through the establishment of networks of practice at the sub-district level with a model health center as the hub. The Ghana Health Service is mandated to provide and manage comprehensive and accessible health services at the district hospitals, health centers, maternity homes, CHPS zones, and in the communities. Since 1978, when primary healthcare was birthed at Alma-Ata, Ghana has prioritized primary healthcare as its central strategy for ensuring a healthy population. Primary health care is a responsibility of the district health system in Ghana. Within the district, health services are organized in a three-tier hierarchy, with the district hospitals at the top, serving a population of 100,000 to 200,000 people. Health centers at the sub-districts for 15,000 to 30,000 people, and CHPS compounds supported by the community support system in the community and local level, serving a population of up to 5,000. Over the years, the emphasis on CHPS and the health hospitals to provide service delivery and local priority setting has resulted in an under-prioritization of the health centers, which serves as a referral link between the district hospitals and the CHPS zones. Health centers have therefore proven to be the weakest link over time because of issues relating to service delivery as well as management and coordination. As of 2018, only 43% of health centers had full complements of equipment. This subsequently limits the ability of the health centers to function effectively. Universal health coverage in Ghana is defined as all people in Ghana have timely access to high-quality health services irrespective of ability to pay at the point of use. Ghana's roadmap states clearly network of practice as one of the main strategies for attaining UHC under the guiding principles of decentralization and strategic partnerships. Networks of practice is therefore one of the key indicators under the results framework for the 2030 UHC agenda. The network of practice is a design model that arranges service delivery assets into a network consisting of an anchor establishment called the hub, which offers a full array of services, complemented by secondary establishments called spokes, which offer more limited service arrays. After the implementation of pilots of primary care provider networks in certain districts in Ghana from 2017 to 2019, great successes were observed with the PCPN in the form of increased collaboration and support, increased range of service delivery activities, better referral and feedback systems, and improved NHIS claims management. The networks of practice shall be established based on the successes of the PCPN, and as such, challenges identified in the PCPN are being addressed in an NOPs for scale-up. The goal is to maximize efficiencies in the use of resources towards improving quality and coverage. In tandem with the Universal Health Coverage Roadmap objectives, the objectives of the network of practices are increased access to better managed quality PHC services, universal access to interventions aimed at reducing unnecessary maternal, newborn, child and adolescent deaths and disabilities, universal access to clinical and public health emergencies. Features of the networks of practice. Networks of practice are a group of facilities, both private and public, in a specified geographic area connected to each other functionally to maximize efficiencies. The head of the hub or model health center is the head of the network. The criteria for attaining model health center status is based on many factors including the NHIA accreditation requirements, HIFRA credentialing requirements, and EMOC facility requirements. The model health centers acting as hubs shall catalyze sub-district level providers to partner together to deliver a more comprehensive package of essential services as well as to maximize efficiency in the use of resources. The networks of practice shall be coupled with telemedicine and teleconsultation services within the network and also connected to the district hospital. The network shall be supported by a performance-based financing system. The network shall also enhance the sharing of both human and material resources to leverage on the full capacity of health service delivery available at the sub-district. The network shall include school-based infirmaries, workplace infirmaries, marketplace clinics, maternity homes, health centers, CHPS compound, chemical shops and local pharmacies, as well as the ambulance service or any local emergency dispatch center, as the case may be. Kindly take note, a district health directorate exploring the possibility of implementing a new NOP model that is context-specific requires formal approval with adequate documentation to prevent deviation from the standard guidelines.
If you've liked this video so far, make sure to give it a thumbs up and subscribe to the channel. Comment down below as well to let us know what you think, and click the card above to view the Policy Visibility Drive playlist.
Methodology and data. There is a need for service availability and readiness assessments of all health centers to help identify health centers that will be upgraded to model health centers to serve as the hub for the network of practice. Proper community entry shall be done to bring all stakeholders such as the Honorable MPs, the Honorable DCEs, the Chiefs and Elders, the religious leaders, the District Assembly, the District Health Directorates, the Ambulance Service, the Local Transport Union, and the CHMCs on board. Advocacy towards community ownership to raise domestic resources to sustain the network of practice shall be done from the get-go. The community scorecard approach shall be leveraged upon to develop an action plan to help sustain the network of practice in that area. There shall also be GIS mapping of existing facilities to form the network. This includes school-based infirmaries, workplace infirmaries, marketplace clinics, maternity homes, health centers, CHPS compound, chemical shops, and local pharmacies. Networks shall be formed based on the model health center in any geographic area. Networks shall be orientated and roles and responsibilities clearly explained, and thus, the network shall be launched. Quarterly monitoring and supportive supervision shall also be done within the community. Functionality of the networks of practice. The leadership and governance framework for the networks of practice is designed from the national level to the sub-national level, with identified roles to be played as follows. Ghana Health Service Headquarters shall oversee the development of policies, guidelines, resource mobilization and formulation of strategies for implementation, define the scope of the needs assessments for the establishment of the networks of practice, institutionalize the NOP's concept into the overall GHS performance agreement system, and establish a technical committee to oversee the scale-up of the networks of practice. The regional health management team shall be responsible for implementing national level strategies and guidelines, developing network key performance indicators for the District Director of Health Services to be embodied into their performance agreement, coordination and resource mobilization, integration of network of practice reviews into existing performance systems, monitoring and evaluation and sharing of best practices for learning, advocacy and collaboration with the Regional Coordination Council and District Assembly, and inter-border and inter-regional coordination of service delivery management. The District Health Management Team shall be responsible for the implementation of the guidelines, that is coordination, monitoring, evaluation, resource mobilization and capacity building, establishment and management of networks of practice, ensuring the equitable allocation of resources among the hubs and spokes, community mobilization, advocacy and stakeholder engagement, conducting supportive supervision, coaching and mentoring, integration of the networks of practice reviews into existing performance systems, monitoring and evaluation and sharing of best practices for learning, as well as the formal appointment of network heads. The role of the district hospital shall be to lead in the provision of clinical support to the networks, undertake supportive supervision, as well as to mentor and coach the clinical staff of the networks. The sub-district health team shall be in charge of community mobilization, advocacy and stakeholder engagement, organization and management of the networks of practice system, integration of networks of practice reviews into existing performance system, monitoring and evaluation and sharing of best practices for learning, as well as manage the NHIA claim submission and reimbursement. In addition to their mandated roles, the health center is expected to take lead in the organization and management of the networks of practice system, planning and controlling of service, coordinate claim submission to reduce the rejection rate, and coordination aligned with the service delivery activities of the spokes. There shall not be any new memorandums of understanding signed with networks of practice facilities. There shall be accreditation of facilities to enable NHIA agreements and credentialing of facilities by HIFRA, as well as strengthening the implementation of the existing MOUs with the private health sector in CHARC and other faith-based providers. To ensure sustainability, the following shall be considered in the development of the network of practice strategy: integration of activities into routine services and harmonization of resources, establishment of appropriate reporting lines, feedback mechanism, embedding change management capacity building in the networks of practice, ensuring strong partnership with all stakeholders, building a system for effective leadership and accountability among stakeholders at all levels, ensuring availability of the adequate human resource for the Model Health Center to play its pivotal role in effective risk management. Planning for networks of practice. There are two main components for planning the networks of practice: network establishment and service delivery integration. Network establishment. There shall be 6 steps for the establishment and implementation of a network: sensitization or orientation or stakeholder engagement, assessment, that is profiling, mapping of facilities and gaps, design and formation, that is gap filling, proposal and approvals, capacity building, and network operation and management. Service delivery integration. The following shall be considered to attain service delivery integration: participatory planning and implementation, integrated budgets, and harmonized resource mobilization, budget implementation, monitoring and supervision. Expected outcome. It is projected that the network of practice, if implemented, will lead to the following: strengthened sub-district governance and leadership, improved community ownership and domestic funding of networks for sustainability, improved sub-district referral systems, improved access and utilization of services, effective management and maximization of existing resources at the sub-district level, enhanced quality essential health services, effective health information systems and knowledge sharing, and lastly, effective teamwork and responsiveness of workforce at the sub-district level. Please note, this presentation only contains an abridgment of the policy document or publication. To access the full document or for further reading, kindly visit the service website at www.ghs.gov.gh. Thank you for your time and attention.